What is chemotherapy infusion for pancreatic cancer? Have you ever wondered how chemotherapy works specifically for pancreatic cancer? Chemotherapy infusion is a treatment method where anti-cancer drugs are delivered directly into the bloodstream. This is usually done through a vein, which is known as intravenous infusion. In some specialized cases, chemotherapy can be delivered directly into the arteries that supply the pancreas, a method called intra-arterial infusion. The main goal of chemotherapy infusion is to destroy cancer cells, shrink tumors, and improve survival outcomes for patients. Common chemotherapy drugs used for pancreatic cancer include gemcitabine and fluorouracil, often referred to as 5-FU. These medications are typically administered as intravenous infusions. The infusion process can take anywhere from about 30 minutes to several hours, depending on the specific treatment plan. Patients usually receive these infusions on a weekly or multi-week cycle, followed by rest periods to allow their bodies to recover. For instance, gemcitabine is often infused once a week for up to 7 weeks, with each session lasting around 30 minutes, followed by a week of rest before the next cycle begins. In addition to standard intravenous chemotherapy, there are advanced techniques like pancreatic arterial infusion. This method delivers chemotherapy directly into the arteries that feed the tumor, aiming to achieve higher concentrations of the drug at the tumor site while minimizing side effects throughout the rest of the body. For example, selective intra-arterial infusion of gemcitabine over a 24-hour period has been studied to optimize drug delivery and reduce toxicity. Chemotherapy infusion can be used alone or in combination with other treatments such as surgery, radiation therapy, targeted therapy, or immunotherapy. When chemotherapy is combined with radiation, it may enhance the effects of radiation on cancer cells, making the treatment more effective. The benefits of chemotherapy infusion for pancreatic cancer include shrinking tumors to relieving symptoms, destroying microscopic cancer cells that may have spread before surgery, and potentially improving overall survival rates. However, chemotherapy is not without risks. Side effects can include fatigue, nausea, lowered blood counts, and an increased risk of infections. The specific chemotherapy regimen and infusion method will depend on the stage of cancer, the patient's overall health, and the goals of treatment. Since pancreatic cancer is often diagnosed at an advanced stage, chemotherapy infusion plays a crucial role in managing the disease. It can serve as a primary treatment or as neoadjuvant therapy, which means it is given before surgery to shrink tumors. Ongoing research is exploring ways to improve chemotherapy delivery, including combining it with other agents or using high-dose vitamin C infusions alongside chemotherapy. However, these approaches require further validation. In summary, chemotherapy infusion for pancreatic cancer is a well-established treatment that involves delivering anti-cancer drugs either intravenously or through the arteries. This method aims to control tumor growth, improve symptoms, and extend survival, always tailored to the individual patient's needs and under professional medical supervision. If you or someone you know is facing pancreatic cancer, it is essential to consult healthcare professionals for personalized medical advice.